Hey guys, welcome again to my channel. Now this video is all about my surgery that is coming up. So this is how I am going to prepare for my surgery, and I know everybody's different. So everybody's body is different, so the way they prepare for surgery is not going to be the same way that I'm preparing myself for this surgery. So this is a major surgery. It's a breast augmentation surgery, so I'll be going through general anesthesia. So I just want, so these are the things that I will be doing in order to get my body prepared. Now I do have the package that I got from my patient coordinator, Karen Higgins, at Plastic Surgery Institute of Washington. So these are the things that they totally tell everyone to avoid before going through surgery. So here it says pre-operative instructions. So 2 weeks prior surgery, it says no aspirin or medication that contains aspirin since it interferes with normal blood clotting. Number 2, no ibuprofen, Advil, Aleve, or medication containing ibuprofen as it interferes with blood clotting. And then it says, please discontinue all herbal medication except for the medication we give you, as many have side effects that could complicate a surgical procedure by inhibiting blood clotting, affecting blood pressure, or interfering with anesthetics. This includes green tea, fish oil, and omega-3s. Now, my doctor did tell me that she does not care if you eat real food containing omega-3 fats or fish oil or any of that stuff, or even green tea, as long as you don't take pills containing or like green tea pills or fish oil pills or omega-3 pills. And she has a problem with that. All right, now number 4, please discontinue all diet pills, whether prescription, over the counter, or herbal, as many will interfere with anesthesia and can cause cardiovascular concerns. So no mega doses or vitamin E, but a multiple vitamin that contains E is just fine. So number 6, no smoking or nicotine in any form, gum or patch, because nicotine reduces blood flow to the skin and can cause significant complications during healing. Smoking should stop 1 month prior to surgery. Number 7, you may take Tylenol or generic of this drug. These do not interfere with blood clotting or healing. Now, 1 week prior surgery, it says do not take or drink any alcohol, drinks, or drugs for 1 week prior surgery and 1 week after surgery, as these can interfere with anesthesia and affect blood clotting. I don't smoke and I don't drink, so that's not gonna be it's not gonna be a problem to me. So if your skin tolerates, use a germ inhibiting soap for bathing for 2 days before surgery and the morning of surgery. Your doctor will tell you if he or she has a specific preference for which soap you should use. Examples include Dial, Safeguard, Liver 2000, which has been discontinued. They don't make that no more, or Hibiclens. Yes. So number 10, do report any signs of cold, infections, boils, or pustules appearing before surgery. Number 11, did not take any cough or cold medicine without permission. Now, yeah, and then number 12, after surgery, you need somebody to pick you up, responsible person to pick you up from surgery to take you where you will be recovering. No Uber, no Lyft, no taxi driver, no buses, so none of that. So it does say do arrange for a responsible individual to spend the first 24 hours with you, since you cannot be left alone. Now, in the night before surgery and the morning of surgery, it says don't eat or drink anything after midnight. And the day of surgery, don't even eat or anything. And when you brush your teeth, don't swallow the water. Try not to swallow the water. If you're on regular medication, please clear this with Dr. Huang. Again, you gotta bathe with that antibiotic soap. She says do not apply anything on your skin or hair, or makeup, creams, long hair gels, sprays, perfume, powder, deodorant. She says none of this, because she's trying to prevent any germs from getting into your body. So if you wear contacts, you must remove them. If you have any wedding rings, you must like tape them with some tape or something, or take it off the day of surgery. Don't bring any valuable jewels, rings, earrings, chains, or any of that. It says we will tape down wedding rings if worn. Again, you must have an adult drive you home to. Oh, hold on. You must have an adult drive for you to and from surgery. Please note that a cab bus driver will not be allowed to take you home after surgery. On arrival, be sure we know your driver's name, phone numbers, and how we'll be able to reach them. So, and it says if you are not recovering at home, it is important that we may have your number where you will be after surgery. Yes, so those are just some of the things that again, before surgery day, you must have your prescriptions ready, because you want to have everything ready before after surgery, so you don't have to stop at the pharmacy or wherever you get your prescription from to get your medicines, because you will be in pain. So again, you can take Tylenol, you can take multivitamin. However, the doctor told me not to take any multivitamin because I'm pretty healthy. Again, this is individual. It varies from individual to individual. Again, gentle foods, anything that will, anything that is strong enough to make you heal faster or to heal better and quicker, I guess. So apple juice, cranberry juice, ginger ale, plain crackers, soups that are not buttery and stuff like that, applesauce, jello, toast, and something probably I'm just gonna be drinking like chicken stew, like organic chicken stew. I know it's so fatty, but I need that because I know I'm gonna gain some weight those 6 weeks. But it's okay because I want to heal really good. So I'm gonna be drinking chicken broth soups and beef bone marrow soups and all that stuff. So I cannot wait. Yes. So and it has a whole lot of like medications, what not to take. This is a lot. I cannot read all this with you guys. Like it says medication to avoid and stuff like that. Oh my god, it's so. And then so we go. So I'm just gonna go down to like, like, all right. So it says keep any dressing on clean and dry. Do not remove them until instructed to do so. So it says after surgery, it is important to have a bowel movement within a day or two. If you don't have it, you may have to get some over-counter laxatives. I have that with me. Again, it's in the closet. So it says minimum activity for the first 48 hours. No house cleaning, furniture rearranging, relax, be pampered, and let your body heal. The less energy you use on doing things, the more energy your body can focus on healing. And this is why I decided that I'm not going to work out this whole week. I'm not going to work out because I want to make sure that my body is going to be strong enough to endure this surgery, because I do a lot of heavy lifting. I like HIIT workouts, and those are, yes, you will be sore for 3 days. So I'm not working out this whole week. So, and then it says limit lifting, pulling or pushing for at least 10 days or more if specified by your doctor. So yep. So it says what is it? So it says position after surgery is different within different types of surgery. So basically with the breast augmentation, you kind of need like pillows, because you can't sleep on your back. Well, you cannot sleep on your side or in your stomach. You need to like be elevated up like this. I guess you kind of need those neck pillows and stuff like that, inclined chair or something like that, because you cannot sleep on your side or on your stomach. You are requested to remain within reasonable traveling distance from the office for approximately 10 days. Once cleared to shower, you may do so every day. Please do not use bathtub for 4 weeks. So no smoking for the first 30 post-operative days. Any cheating will delay your healing. And so avoid sports or very heavy activities for at least 4 to 6 weeks, as your surgeon gives you clearance during your post-operative visits. So it says this is to avoid any unnecessary complications such as bleeding, bruising, or swelling. This is why I am not going to be going to work anytime soon. So yes. So it says you may return to work when you feel able and are cleared to do so by your surgeon. Yes, so those are just the basic stuff from the doctor. Or so yeah. So since this surgery, like, this is not my first time having surgery. Like, all my children, I had via surgery, C-section, so I know what to look for. So I am pretty prepared for this. Again, I'm not working out. It's not really hard for me because, like, I know that, this, just not working out for a whole week, it's for the betterment of my body to heal better. It's going to be better for me because healing will be easier, and I'll be able to, get back up easier, and I will get back to my working out. Again, I'll be eating, again, I'll be drinking a lot of chicken broth soups with some crackers or some rice. Yes, I'll be drinking a lot of beef soup, bone marrow soup, stuff like that. Everything is going to be organic because I like buying organic chicken from the African international stores. So they have like some really good chicken. So like the chicken is so good. Like, you cannot compare this chicken with chicken from Safeway or Costco or like Giant. Like, this chicken is the best. So I'm going to be taking that. I'm going to have a lot of beans, and yeah, so I'll be prepared. I'm going to be drinking a lot of water, going to drinking some juice just to give me some energy, and I'm going to be just relaxing and just letting my body heal, because again, this is a life investment, guys. Like, I've been waiting to do this since I was 19 years old, and finally God has given me the opportunity to do it. Yes, and I believe he's going to be with me, so I am not afraid of anything. Again, the surgery cost, I decided that I was going to tell you guys how much this surgery cost. It cost $7,270, everything put together. So let me see. So I hope I have the breakdown for you guys. I'm not sure if I have it on a folder, but I don't know if I have it in my folder, but I think I do. Anyway, so this is what it is. Okay, so basically this is what it is. So I'm just going to break down everything for you guys. So breast augmentation bilateral silicone, which is $3,950. Implant gel mentor, both of them $825. So you add those, so you add 825 plus 825, it comes up to $1,650,000. And then she also uses the implant funnel supply. She's not going to use her hands to put the implant in. She's going to use something called a funnel, yes, which costs $100. And then there is the anesthesia fees, which will be handled by the ASC of Bethesda, which is $570. And then there is the facility fees, which will be handled by the ASC of Bethesda, which is $1,000, which I just paid. That was the remaining balance that I just paid at my pre-op. So in all together, it comes up to $7,270. Yep. So yeah, so that was my procedure. So everything is paid for, and I am ready for this. So you guys, if you are looking into this, I'm just going to tell you guys, like, from my own knowledge of these things, if you are into God and you are a born-again Christian and you are wondering, should I do this or should I not? Like, for me, I just tell you, pray and ask God. If it is the thing for you, he will let it happen, because everybody is different. Your reasons are different from my reasons. So now for everybody else who is not in the, who are not into, God and religious, or I would not call myself religious, but I have a relationship with Jesus. So if you are not there, I'd probably just say, just make sure you're doing it for the right reasons. Don't do it just because everybody else is doing it. Do it for the right reasons. If you feel insecure about yourself and getting breast implants will make you feel good, then I suggest just do it. And I suggest that you wait until you're older and mature enough to know that this is something that you want to do, because again, it's a permanent decision. You can't just get it and go back unless you're rich and try to undo it. No, it's a permanent thing. Okay, yeah. The other thing is, our implants lifetime? Well, really, there are man-made stuff. Nowadays implants can last at least for 20 to 30 years. So you don't have to change them every 10 years if you don't have to. As long as everything is fine, as long as the doctor says you're good, then you are good. You don't have to go back and change them every 10 years. No, they can actually last a lifetime depending on how old you are going to be getting them. So if you're getting them in the 20s, you might want to change them in your 50s. If you are getting them in your 30s, you might want to change them in your late 50s. I'm just saying. So yeah, so guys, that is it for this video. I hope I was able to help you guys with anything. So again, oh, my hair. So my hair, I'm going to be having a protective styling because I cannot do my hair for 6 weeks, and I know for sure my husband will not be able to do my hair because my hair is very it's high maintenance. Like I have natural hair, and you know I have curly hair, and he won't be able to do it, trust me. So I'm going to have it on a protective styling, and it's gonna last me for 6 weeks. After that 6 weeks, I'll be able to wash my hair. So I might not be able to wash my hair for a while. So anyways, but I will be fine. It's just hair. It's not gonna be dirty. It's just hair, guys. I'm not gonna be working out, so no sweating, no nothing. So other than that, guys, this is it for this video. I hope it's not too long. If you are new to my channel, please don't forget to subscribe to my channel and hit that subscribe button to get notified when I do upload a video. And if you are back to my channel watching my videos, thank you guys so much from the bottom of my heart, and I will continue to support you guys with your videos. And if you are new to my channel, please drop your channel down below, and I will check it out, and I will also support you. Thank you guys for watching. Until next time, guys, bye.